Welcome back. I recently had an interesting discussion about mental health and the economic impacts of mental illness and such. So let's take a look at our conversation.
A new landmark report examines the human and financial costs our country has paid by not investing in mental health care. The staggering data reveal nearly 117,000 lives and approximately $278 billion could have been saved over a 4-year period. Researchers at the Satcher Health Leadership Institute at Morehouse School of Medicine say these are just some of the findings of the economic burden of mental health inequities in the United States report. Who are some of the most impacted? Well, according to the report, it's racial and ethnic, minoritized, marginalized, and under-resourced populations. Well, our guest today says part of the problem is policymakers aren't getting the full picture to make decisions, and we're all paying that price. Joining us now to explain is Daniel Dawes, professor and executive director of the Satcher Health Leadership Institute. Daniel, thanks for being here today.
Thank you for having me.
Professor Dawes, tell us how this report came about and what surprised you the most about its findings.
That's a great question. You know, it took me 15 years to finally convince an organization that was aligned with our research agenda and our vision to invest in such a study, right? And we finally found an organization that said, yes, this is worthy of studying, and not only studying, but worthy of reporting out nationally. And so we are extremely appreciative of Otsuka America Pharmaceutical for realizing and helping us to realize this dream come true. You know, the 16th Surgeon General, my dear friend and mentor, Dr. David Satcher, has consistently stated, and he was the first to state this 25 years ago, imagine that, right? That there is no health without mental health. And we know that as we dig down deeper and as we're looking at the population groups who have been most impacted by this, we wanted to study the health and economic impact. And we found, as you mentioned, that 117,000 racial and ethnic minorities died prematurely between 2016 and 2020. And it cost us $278 billion. And that's an underestimate.
Tell us more about the impacts of neglecting mental health, especially for minority populations, and why policymakers aren't getting the full picture.
Well, one of the reasons they're not getting the full picture is because of the limited data sets, right, that are out there that highlight mental illnesses in this country, substance use disorder rates in this country. And within that limited data set are groups that have been excluded from these data sets. So you're talking about, people with higher rates of mental illnesses being excluded from mental and behavioral health related data sets. So those who are incarcerated, those who are active military, those who are in assisted living facilities or nursing homes or in our foster care system. We're talking about 6 million Americans that have been excluded, and it really does create quite a void. And this is detrimental on many levels. Most importantly, lives are being lost. Yes, but also, decisions are being made based on inaccurate data, which is perpetuating, an ongoing cycle of inaction by our policymakers, quite frankly.
Our current mental health system is not set up to serve those who need the most help. What can we do about it?
Well, there's a lot that we can do about this, right? The fact is that we're all in this together. 20% of Americans across all racial and ethnic groups, whether you're white, Asian, Latino, Black, Native American, all of us, are struggling either ourselves or with a loved one or a community member, quite frankly, right, with mental illness. And as we age, that number climbs to 50% of us, right, will be struggling with mental illness. So it so happens that there is a lot that we can do. I think first and foremost, we can all come together and we can all do our part to really destigmatize mental illness, right? To not make it so that this is an embarrassing topic of conversation. I think once we help to move the needle in that direction, that will actually lead to some, increased access, I think better improvements in health outcomes and the like. And then I also think from a policy standpoint that people go out and vote, that they amplify their voices, that they make sure that our policymakers, our lawmakers know that brain health is absolutely critical to systemic health, that we need to prioritize mental health policies, behavioral health policies in America. Because if we don't, we're going to continue to see the dearth of data, the dearth of policies and programs, and the status quo continue to go on.
go to learn more about this?
You know, that's a really great question. I think on the eve of Mental Illness Awareness Week, which, occurs in the first week of October, there's so much that we can learn. And I think it starts with going to our website at www.satcherinstitute.org. That's the Satcher Health Leadership Institute, to download the report.
Will do. Well, thank you so much, Professor Daniel Dawes, for joining us today. I really appreciate this
My
essential
pleasure.
information about mental health.
Thank you so much for having me.